Good afternoon, everyone. I'd like to call this December meeting of the Jail Oversight Board to order. Can we all rise for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. In addition to who's here in person, we have joining us virtually Ms. Deb Love and Judge Brennan, as well as our solicitors. Administratively, we did have an executive session yesterday to cover matters of personnel related and also a few matters of public safety. And with that, we'll move to the first item on our agenda, not the first, but the third, I guess, item on the agenda. Second item, which is public comment on agenda items. So if there's anyone from the public who would like to address the board, please do so now. Hearing none, we'll move on to item 3, which is an approval of the minutes from November. Is there a motion to approve?
I'll move.
We have
I'll
a motion
second.
and a second. Any questions or comments on the minutes? Hearing none, all in favor?
Aye.
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 Any opposed? The ayes have it. Next item is an approval of the November reports. Is there
I'll
a
make a
motion?
motion.
Second.
We have a motion and a second. Any questions or comments? Hearing none, all in favor? Aye.
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 Any opposed? The ayes have it. And I see that Sheriff Sanders has also joined us. All right, next is the Warden's report. Warden Williams.
Thank you very much, Councilman Madden. Good afternoon, Jail Oversight Board. We'll have Sean cue up the presentation for us. So I wanted to thank, I'm certain that the board will offer some comments, but we did have an unannounced inspection that occurred at the facility last Thursday. Additionally, today we had members of the PA Prison Society. There were 4 individuals representing the PA Prison Society who came to the facility today also for a tour. The last time they came in for a full tour or inspection or review was December 7th of last year. And because we went through a transition and they had published a report, they wanted to ensure that they did an annual review to determine if there had been any changes. We assume that we will receive a report in the future. Today, they did provide some briefing comments to us about noticeable changes from their last visit, which was very encouraging to hear, and also allowed for us to provide some accolades that were much deserved for our staff. In terms of infectious disease updates, there were recent changes within the recommendations that were published by the CDC. They actually included congregate settings that include homeless service sites as well as correctional and detention facilities for updates. The primary difference between the recommendations indicated that you would do further restrictions when the community rates were high, and that the recommendations of 10 days of quarantine could be reduced to 7. That would definitely be dependent on whether or not symptoms were present or if you have disease presence within the facility. So those changes were updated. They are available by a simple search on the website for the CDC if you would like to read those on your own. We are, as a county, still in the medium transmission rate, and donning of masks remains optional within the facility. They are available at no charge for staff as well as the incarcerated population. In the month of, and there is a typo there, but in the last month, November, our facility tested 98 incarcerated persons utilizing PCR tests. 2 out of the 98 were diagnosed as positive for COVID-19. We have 0 positive cases for our incarcerated persons currently. I did just receive a briefing, so this slide is inaccurate. It says no staff are currently out with COVID. I actually have 1 staff with a confirmed positive and 1 that is pending results. So I wanted to make sure that I acknowledged that that is inaccurate on the current slide. We have no confirmed or suspected cases of monkeypox within the institution. Monthly statistics, our current population is 1,218 incarcerated persons, which is a decrease of 11 from last month's meeting. We are continuing the Weekender program that resumed on October 22nd, and our participants within the month of November was 201. 32 of those were first-timers, and by that I mean it was the first time they reported for their Weekender sentence within our facility. Total commitments in the month of November was 547, with discharges totaling at 573. We have continued to allow and encourage full recreation of the housing units throughout the facility. There were a few instances when full recreation wasn't provided, and that is listed there on this slide. We had one of our housing blocks that was impacted due to an event that was reported during last month's meeting as one of the major incidences. We did have them on 4 cells at a time for a period of time, and then we transitioned to tier recreation within that first week of November before increasing back to full housing block recreation. Additionally, we had 2 other instances, and you can see those cited there. Major incidences in November. We had 1 suspected overdose that required Narcan administration in the facility. That individual had a full recovery. They were transferred to the hospital to have additional care and monitoring services, and they had a full recovery. We increased the number of shakedowns from October to November throughout the facility. I believe in October we had 11. In November we did 18 full searches. We maintained the number of cell searches between the months of October and November, and identified serious contraband 14 times in the month of November. Any questions related to monthly statistics?
Board members?
Okay. Moving on, you can see that since our last meeting, we were able to acknowledge and celebrate 2 different classes that completed their basic academy training. On November 18th, class 1022A was sworn in by Honorable Judge Whalen, who is also a board member for those that might be listening or present today. And on December 2nd, last Friday, class 1022B was sworn in by Honorable Judge Klein. We did also just start a new class in training on December 12th. That was this Monday. And that wraps up the number of academies that we have currently going for this calendar year. We will begin our next training academy on January 9th of 2023. There are 3 classes currently in training at this present time. I've included a screenshot of the website, so any listener or current participant in the audience, you can Google George W. Hill Correctional Facility, and when you do, you'll come to our webpage. You'll see in the lower left quadrant, there's a section for careers, and this will take you to another link that has all of the different job description postings and will actually allow you to apply online for any of the positions that are currently available. We were also fortunate that throughout this 2022 year of assessment and evaluation of the facility, we have been able to identify opportunities for expansion in some departments that will increase the efficiencies of the operations of the facility. And we were provided the opportunity to expand our personnel through county council approval. And those positions have recently been added to the website for job applications for those that might be interested. These can be found under the career section. We will begin interviewing for all of those vacancies soon, but cannot fill those positions until January 1 of 2023 when they are part of the authorized budget. We, again, celebrated Employee of the Month. And this year, our December Employees of the Month are Kelly Shaw, who we will hear from later. She's our program administrator for reentry and program services. Fred Pascal, who is a correctional officer, and Debbie Dunlap, records technician. Sorry. Debbie suddenly passed away on December 8th. And she leaves behind a son, a husband, many dedicated friends and colleagues who have worked with her for several decades, and many transitions at the facility. She has been a staple in the institution, and her loss, though it hasn't even been a full week, has been extraordinarily noticeable. She will be laid to rest on Monday, and it was important to us that we acknowledged and recognized her here during today's meeting.
On behalf of the board, I just want to express our sympathies to her family and to Debbie for everything that she gave to this institution. I know she really became family to so many of you who worked alongside of her. So we are all very saddened by her loss.
Thank you. We frequently refer to the George W. Hill family, and when you work in the field of corrections, and it's been spoken very publicly, many of our staff work very long hours, very frequently alongside each other. And you usually can't get through those periods of stress without building a support system. So we talk a lot about having a biological family and having a chosen family. And at George W. Hill, there are many, many members of a very large family of people that have survived a number of challenges and traumas. And what they've gone through over the many, many years that they've worked there and the way they've supported each other and continue to do so is pretty remarkable. That's usually not the newsworthy part of what we get to see and experience every day, but the camaraderie and the support is genuine, and they all really do get each other through each day. So I appreciate the opportunity and acknowledgement of that from this board. In the last month, we were able to have a pretty big high, so we have peaks and valleys in our field. But this one was an incredible high for us. Inside Out, which is a national program, and it's a partnership between higher education facilities who will teach college courses within correctional facilities. And they will have inside students, meaning those that are incarcerated and engaged in the criminal justice system, and outside students are learning alongside each other. It is a true college course. There are expectations, there's homework, you must attend classes, you have to be active, engaged, and participating. And we had the opportunity this year to host and partner in our very first Inside Out program. And I wanted to extend a thanks to several board members who not only were part of this program coming to fruition, but also for being present for our closing ceremony and being able to witness the heartfelt speeches that were delivered by both our inside and outside students. And thank you to Councilman Madden for your opening remarks as well. We were able to participate in this, and throughout the growth and development of the program, I hadn't even realized we were the first partner for Penn State University Brandywine. That Inside Out is in its 25th year of operation. The course was taught by Dr. Angela Putman, and she's been teaching for about 16 years, I think is what she had said. And this was her first time ever teaching the class, and she reported it forever changed her. We spoke a little bit about how these students, whether they could feel the weight of it or not, were part of institutional history. And that feeling and that experience that they gained will never be replicated, even though we are committed to continuing programs and partnerships like this that can't be redone. This was the first time. And the speeches that were delivered were just unbelievable. So we really we were excited to be able to have the opportunity to participate in that. We're so thankful that Sean Rush from the county was able to be present. He made that available so that family members could stream the speeches and the closing ceremony, which I think was remarkable that they were able to. We were able to bring some of the outside in so that they could feel support. That meant a lot to the participants, and also really appreciated Bill Tyson. So the images that you can see on the screen were provided by Bill Tyson and Penn State Brandywine for our utilization as well. So I know that there were board members present. I don't know if you want to make any comments.
Yeah, having been lucky to be there for that evening, I went in with high expectations of what that program could look like, and it really surpassed them. It was abundantly obvious, I think, to anyone who was in the room, just how affected each of the students on the inside and out were by the experience. I think it was clear that, understandably, I think people came into it with a certain perception of what they were going to be facing on both sides. And the bond that you saw, just how close the inside students and the outside students had become over the course of the semester, was really touching. And I think, I said this that night, I think as a general matter, we're better off the more empathy we build and the more walls we break down of the metaphorical type, so that we can identify the humanity in the person on the other side. And I think that was really the theme, at least for me. The big takeaway was just how vividly that occurred. So I'm really grateful to the staff for their support in making it happen. I'm grateful for Penn State for supporting it in such a strong way and bringing it forward to us. Sean, great work. Thank you for what you did that night, and I'm really excited for what it can become. I hope it's really the start of something bigger, because it really embodies, I think, a lot of what we've talked about for the reimagination of what a county jail ought to be. Not something that's behind the shadows, but rather where it's incorporated into the community, and the community really takes a part in restorative justice for those who are there. So thank you for making it happen.
Yeah, I just want to say I appreciate the invitation to be there. I thought it was phenomenal. The speeches were great. I thought what was really interesting for me was just having people in street clothes. I really didn't know who the inside people were necessarily, or the outside. Then I realized, well, it was mostly the men that were inside and not the females. But it really put everybody on a level playing field, which really opened my eyes to, I think, what the students were experiencing in terms of bias and what you think, and what Councilman Madden said about the empathy. So it was really a great program, and the speeches were terrific. Mm-hmm. And I still think they should Penn State should get them up in writing somewhere for like a newsletter, because some of the research and all was just really terrific. So, mm-hmm. And the joy on the people's faces, they were just experiencing joy of learning and sharing with everybody. So it was great, and I hope you can keep doing it. And again, thanks to the staff for making that happen, because it had to be a lot of work, just getting people in and out. Mm-hmm. So thank you.
I wanted to highlight some of the initiatives in a community partnership, and this is not in any way to imply that this is all Delco CPR does. They do so many different things. And for those that are listening who may not be familiar, Delco CPR is the Delaware County Coalition for Prison Reform. They were formed at the end of 2017 to organize and fight for local prison reform. That information is available on their website, as well as a lot more about their mission. This is not the first year that they have conducted a holiday card drive for the facility, so I also wanted to make sure that that was known. This isn't new just because of the county transitioned the operations of the facility, but did want to highlight such a successful venture. So they petitioned or advertised to membership, as well as other individuals within the community that follow their efforts in the organization. Last week, they were able to deliver 700 holiday cards, to include Hanukkah cards as well as those for Christmas, and another delivery of approximately 700 this week as well, to ensure that every person within the facility has the opportunity to send their family member a card. And the postage is covered by the Inmate Welfare Fund, so that we can send those out into the community without any additional cost to the incarcerated person. But this was just an extraordinary effort. In a very short timeline, they were able to organize this and work with us to support this. So I wanted to make sure that they got some due credit, because that is extraordinary and not something that I'm aware of happening in many other facilities across the Commonwealth of Pennsylvania. In line with the holiday spirit, though this is not necessarily a Delco CPR initiative, we have invited or extended invitations to some of their members to be able to participate. But next Friday, we are going to have a gift packaging, which the Jail Oversight Board did support in us purchasing items so we could put together a holiday package for every incarcerated person in the institution. So those will be packaged by volunteers and staff members and then distributed to the population on the 22nd. Because this is the last calendar year Jail Oversight Board, I wanted to kind of wrap up some of the capital improvement and project updates. In July, specifically the 12th, Danielle Floyd, who's the Public Works Director, had given a presentation to the Jail Oversight Board regarding the capital improvement investments for George W. Hill. And at that time, we were estimated at a value and earmarked for approximately $30 million of necessary investments for the physical plant or infrastructure of the facility, to include these 4 separate large projects, one being domestic hot water, another electronic security and surveillance, kitchen renovations, and HVAC and roof replacement. So I have identified that we've been making progress through multiple different county departments who have supported this, as well as the Oversight Board and County Council, that we did have our kickoff meeting, and we are anticipating demolition and construction for the domestic hot water system. This will reduce our reliance on a temporary solution and give us a more sustainable and permanent solution for the facility. We have 75% of the drawings completed for our security and surveillance system, and then we'll continue to make progress. We are going to be demoing camera systems this week, actually, to hopefully progress and advance that project forward. Concept drawings are in process for kitchen renovations, and we are exhausting every single avenue that we can to make sure that we are doing the most fiscally responsible as well as operationally necessary renovations to ensure that this is not a temporary solution, but a more permanent and forward-thinking approach for our kitchen in the facility. And then an RFP will be constructed and released in terms of the HVAC and roof project within the first quarter of 2023. And all of these are able to happen because of the partnership that we have with Public Works, as well as many other partners in the county, to include the purchasing department, to make sure that all of these things can progress on a timeline that is truly necessary within the institution. Cost recovery items, you can see in the left-hand column what was recovered within the last month, and then the year-to-date totals on the right. And again, just in case somebody's listening for the first time, the portion that is in the bottom half does not go to the general fund. That is deposited to the Inmate Welfare Fund, and that is any person that left the facility with less than $1 on their account. Again, those numbers are very nominal that are deposited, but that has saved a lot of resources and time for staff. This image, which will look very small, is also already in the Warden's report. So this is a look back at the last 3 years. And I do like this because it calls to attention some of the different trends or differences in terms of commitments, discharges, as well as evaluations that are happening. And numbers say one thing, not everything. But it is a good way to be able to look at the last 3 years and be able to compare. So I included this slide simply because I think that it's information that's worthwhile, and that we will likely have continued discussions as we're moving forward. So I think a 2022-2023 comparison is going to be very important for us, because we will be comparing apples and apples in the near future. But we can look at, trends within the county at large over the last 3 years. Before I get into the next couple of slides, there is going to be absolutely no way that I could talk about all of the incredible work that has been done. And that is not to say that we don't have a very, very long way to go, and that there is commitment and investment and dedication and persistence and relentless follow-up that needs to happen for all of the initiatives that have been put in place. But I did want to highlight, since this is the last Jail Oversight Board for this calendar year, some of the work that has been done. not representative of everything, but does give a high-level view to make sure that we're kind of summarizing what has taken place in terms of the transition efforts this year. Healthcare Services was the first to transition, and they transitioned to WellPath leadership on March 5th of 2022. Aramark Commissary and Dietary Services transitioned at the end of March, beginning of April. The reason why there's that timeline is because we had some overlap in terms of commissary deliveries. So Aramark was really full force and independent at the beginning of April, but transitions for both really started around March 20th. On April 6th, 2022, at 12:01 a.m., we transitioned from private management firm to full county operations and management. And though this was not a picture of the first roll call, I do have that one, but it was at night, so it's a little bit darker in image. This was the first day shift roll call with everybody in a county uniform, which was a very impactful image to be a part of as well. Leading up to this transition, the facility had to prepare and required the support and partnership of many county departments. And though I've tried to give appropriate shout outs throughout the year, I have to do it again. We would not have been able to do this without all of the support from the County Controller's Office, Human Resources, Information Technology and Systems, Public Works, Park Police, the courts, the Office of the District Attorney, Office of the Public Defender, Human Services, and Pretrial and Probation. And I am certain I'm forgetting to shout out a county department. I can't do that without, noting the Jail Oversight Board, but it was pretty monumental leading up to, and I think sometimes we forget how much really went into it and how much we're still doing to make sure we can get things right. It's pretty well known that I come from a bit of a psychology background, so I offer this slide only because I think it's important to talk about how change really does occur. This is a model. It's not mine. I didn't come up with it. It was developed in the late 1970s, and it was originally for smoking cessation. It's been utilized in a number of different therapies. It's frequently referenced in therapies where behavioral change, such as substance use disorders, is usually the focus. And it has also been applied in a lot of industry and organizational psychology concepts as well to promote sustainable change. So you start with pre-contemplation, where you're not really sure whether or not there's an issue. Contemplation, where you think there might be, or there's an opportunity to change. Maybe it's not a problem. Preparation, where you're really doing the most important work of any of these stages. If you do not build a strong, prepared foundation, change will never be sustainable, and it will not be long-lasting. So preparation is unbelievably important. Once you've completed that, you commit to action, and then from action, you maintain. I bring this up because we're not the only facility that has ever gone through this, but we were required to maintain operations while preparing and putting to action. So we were in 3 different stages of change, while also contemplating what we wanted to do in the future, all at the same time. And that's not a me thing, that's a we thing. I have an incredible team of employees at every single level, every job title, every job description, that if it weren't for their commitment, we wouldn't have the success that we see today. We still have a lot to do. I want to provide a balanced, perspective, but it is remarkable that we were able to maintain operations and continue to make progress forward. One of the first things that we did as an agency was develop a vision statement, a mission statement, and our values, which I know I've introduced in the past to this board. In terms of employee and staffing, we have onboarded eligible staff that previously worked in the facility, utilized recruitment efforts to gain external staff. We did that through partnerships with job site interviews as well as recruiting agencies. We've continued recruitment efforts to fill vacancies. We've offered retention bonuses, sign-on bonuses, referral bonuses. We transitioned with technology, and I think we're one of the departments that first started utilizing DocuSign, which I do believe has been replicated in other departments as well to increase efficiencies for onboarding. We've evaluated positions within departments and proposed additional positions to expand and enhance in the 2023 year. We secured contracts for uniforms, which is very difficult with the supply chain issues, on a very short timeline, to include duty belts to make sure that our officers and staff had the supplies or the tools necessary for them to do the work that they have to do. We've developed websites for online uniform ordering for our staff. We've implemented Employee of the Month programs, celebrated Correctional Employee Weeks, promoted internal candidates for leadership roles. We have done department head leadership, National Institute of Corrections training. A number of different categories have been completed by our leadership team. We've expanded the training department to include a major of training who was recently certified through the Pennsylvania Department of Corrections for Train the Trainer, and have 2 additional full-time instructors. Training is where we've seen a lot of our revision and enhancement, and it is not a department that has completed the process. When we talk about preparation, that stage of change, training is probably one of the most important things to a safe, secure, and sound facility, and we will continue to provide attention and support to that department to ensure that we are giving our staff the tools required to be able to effectively conduct their duties. We've implemented a supervisory development program, increased qualified personnel for firearms certification, partnered with Miramont Treatment Center or Mainline Health for HERO, which is helping emergency responders overcome, which normalizes and destigmatizes a lot of mental health as well as substance use concerns. We have increased our cadet academy from 4 weeks of basic training to 6 weeks, included formal graduations and administration of an oath, developed a cadet handbook and a progress report card. Through support with the Jail Oversight Board and County Council, we have obtained Apex Virtual Reality Simulator, and we've begun utilizing it. We've also done additional training with the National Incident Management System and Incident Command training for our security department leaders. With the assistance of the Controller's Office, we were able to convert our payroll system for utilization of UKG and Kronos. We negotiated purchase of assets from the previous provider to ensure we had the items necessary for transitional needs, developed and submitted our 2023 budget. We've been able to complete a facility asset inventory, update facility intake and storeroom areas. We have had 2 successful food service health inspections of our kitchen with the Department of Health that was recently established this calendar year. We've completed a successful Title 37 audit and inspection and have reviewed all policies within the institution. That is an annual thing. That is something that we'll need to accomplish each year and ensure that we're enhancing those policies and procedures. In fire and safety, we also met certification and inspections of fire system, completed 31 fire drills and 7 suicide drills, and implemented a sanitation program with unit expectations and incentives. We've expanded our one-to-one tablets for the entire population, expanded the functions on those tablets to include increased free services with over 20,000 hours of EDOVO free education and programming. All tablets have law library services. There is texting and email available for the incarcerated persons. We've converted our electronic mail system. We have expanded, or we will be expanding this month actually, video visitation systematically throughout the facility. We have redesigned the George W. Hill website that also provides frequently asked questions and process for the criminal justice system for family members who may be navigating this with their loved ones for the very first time. We've maximized the utilization of offender management system to include case management notes and increased discharge planning. We have increased the out-of-cell time and recreation for the full population, implemented suicide prevention blankets, expanded commissary menus, added eye care packages, expanded incarcerated person job availability, and resumed monthly block rep meetings, which allows us to communicate directly with the population in a formal meeting each month with administration and department heads for increased communication. We've expanded workforce development to resume, expand, and continue Flagger Force, certification for skills and trades with Spartan Chemical Company, resumed sex offender treatment with our mental health coordinator, resumed in-person religious services, resumed barbering and salon services for the population. Many of those items were shut down as a result of COVID-19. So as we've been getting back to normalcy within the institution, we've been able to re-engage the population with these necessary services. We have secured federal funding, and that was in partnership with Delaware County Workforce Development to implement training and employment services with EDSI, partnered with community-based organizations for program development with the juvenile population, added a full-time instructor for education services, and continued to provide GED testing services. That was predominantly done by one full-time instructor teaching a large number of students and getting them to full fidelity and capacity for their GED testing. So a lot of the numbers that are reported each month, I don't think people really realize that that has been done predominantly with one person's continued efforts. We partnered with Delaware County Elections and League of Women Voters to assist in voting registration and voting, and partnered with Penn State Brandywine, which we had talked about. Again, that is not everything that has been done, but is quite a bit, and it was wonderful to be able to compile the list and reflect on all of the work and commitment for those initiatives. Looking ahead, we took our list of things to do and continued to add to it. We need to increase retention and decrease attrition within the facility. We believe we'll be able to achieve this by ensuring that the interviewing, onboarding, recruitment, hiring, and training process is stronger and enhanced. We will reduce vacancy rates. Our officers need relief. They need a break. They deserve it. They've been working very hard. It's my hope that we'll get to a point where overtime may never not exist because we'll have vacation or illness that will occur, but that we will not be mandating or requiring officers to work. We will continue to invest in professional development, and that's not just promotions. That would be gaining additional certifications or training. We will cross-train with other county jail facilities or leaders within the field of corrections. We will develop onboarding and training for non-security roles to ensure that they're doing very fulfilling work and that they feel supported throughout their orientation process. We do not want the scale to tip too far that we're predominantly focusing on security roles where our largest number of vacancies are. We need to ensure that we support all of our departments and employees within the institution. We endeavor to at least start our kitchen renovation, though if we could complete it, that would be probably not reasonable, but incredible for us to do in the next calendar year. Replace the roof and HVAC system, enhance lighting, update staff dining facilities, replace laundry equipment, and develop a training and firearms facility. We will fully implement Power DMS, establish Wi-Fi infrastructure in the facility for enhanced technology and efficiency, execute the contract with Guardian RFID for monitoring, convert our grievance process to tablets to allow for increased functionality as well as tracking and responsiveness, convert commissary ordering to tablets, implement a body scanner, increase camera surveillance. We will increase, with the support of council as well as Jail Oversight Board, the incarcerated personal pay rates. We will increase program availability and access to recreation equipment outside or during their out-of-cell time. For our budget, we will increase sustainability. We do not want to fund all of these items through county taxpayer dollars. We want to find other sources of revenue so that we can continue to expand without putting the burden additionally on the county. We will increase services for youthful offenders, enhance services for medications with opioid use disorders and other substance use abuse disorders, increase psychoeducation programs to include parenting, relationships, job readiness, life skills, increase our partnerships with local universities as well as treatment providers in the community to ensure that our persons do have a place to transition if they do not have a stable place to go home to. We will increase community engagement and stakeholders for ease of reentry and reintegration, increase partnerships with other field of corrections leaders, increase the utilization of Apex virtual reality simulator and embed that in our annual in-service training, enhance the documentation, tracking, and control of all completed trainings, and increase certifications throughout a multitude of job classifications within the facility. And again, this is not everything that we intend to do in 2023, but I feel very confident in my team. I feel confident in the vision that they have, as well as their commitment to make sure that these things happen in the next year. Are there any further questions or comments from the board?
Board member comments?
Could you send some people to the controller's office to help me do that? That was amazing. I don't know how you can even have time to get your thoughts together with all the work that's been done in a short amount of time. It's really impressive, and I know we have lots of work yet to be done, but I'm hoping that the papers can grab the headlines of all the progress that's been made. And you're right, it's just been all done at the same time, contemplating, preparing, evaluating. It's just been a tremendous amount of work on your staff's part and other places throughout the county that have been working, and this board too. I mean, and people don't know, we've had like a weekly call for almost 2 years to go through things, and then continued it this year. So I congratulate your whole team for everything. And not everything's perfect. Nothing can be, but we can all strive for just improvement. And if this doesn't show it. One last thing I would say, just a short amount of time, none of, if there was any progress, none of us would have known about it. No public would have known about it. People were trying to get in to find out about it. The model didn't work. This model shows the transparency, and the public will know what we're doing, what we care about, and I'm really proud of the work of all of you and the work of the board too. So thank you for that. That was great.
I'd like to add on, it has been a pretty remarkable year. If you think back 12 months, Warden Williams was still in Allegheny County, and we were sitting here sweating out staffing and getting through a transition. The fact that we've been able to stabilize and move towards thought and practice leadership and start to get recognized for the actions that have been taken is really quite remarkable. That's due to the fact that we were able to engage this wonderful and highly motivated and skilled leadership team. The support of the Oversight Board and the Council has been remarkable, and nobody ever lost faith, even though there were a lot of twists and turns and bumps in the road. I think it's always good to be content but never complacent, and be satisfied but not think that we've done everything that we have to. The Warden has talked about things that we still need to do, but the transition will go from stabilizing and taking over to really integrating all the county services and providing new opportunities for people who are placed in our care, and incarceration becomes a stepping stone to a better life for everyone who passes through George W. Hill. I think the personal relationships that have been formed over the last year are remarkable as well. You don't think about prisons as being a place where you experience joy, but to see the stereotypes being broken down and people's lives being changed is really quite remarkable. So to the staff out of George W. Hill, particularly with Warden Williams, I just owe you a debt that I don't think we can ever fully state how important it is.
Thank you, Director Lazarus.
I want to thank you, Warden, for sharing that year in review. Just thinking back on the accomplishments and the barriers that have overcome, and to kind of echo what the executive director was talking about, is just setting those goals as we move forward. I know for me, continuing to hear things, my ears ring when you come up and say, we'll be the first county jail doing this. This is an innovative, outside the box idea. And for me, when we did that vote in April with the county taking over, it was so we had the ability to make decisions to follow through on initiatives like that prior to we weren't able to make the decision to say yes to something like that. And just really, when we talk about that mission, and, there is no limit, right? So as we're talking about these goals and these accomplishments, really focusing on how do we get that, what services, what programs, what continued initiatives do we put forth to get that recidivism down, right? Like, what does it take? Some things have been, done a certain way for a very long time. How can we do it different to get different results? And I just think that being creative, being innovative, and having the support of the county in doing that, I just completely encourage you to keep forward thinking in this process. So thank you.
For my part, and a little bit later, we will talk about the unannounced visit that the Jail Oversight Board had for last week. But I want to say and echo my colleagues' remarks. It really is remarkable how much has happened in such a short period of time, and where we were this time last year and where we are now. It all starts with a vision, and having that vision trickle down through a workforce. And that doesn't happen overnight, but I think we've made some great strides. We still have more to go. And I think, that's really, anyone who's sort of hearing this, I don't want anyone to sort of take away that, the Jail Oversight Board, the warden are spiking the football. I think we all know we have a lot of work still to go. We are not at the jail that we all envision for this to be the model that we want it to be. We're making strides, but we still have a long way to go. But I think it really is remarkable to hear everything that you've gone through and the team has gone through. So I thank you and the team that's here, and everyone who perhaps might be watching from home, for sticking with the county through such a challenging time. I am eternally grateful for those public servants that work at the jail. I will also kind of add, you talked about the budget and finding ways to make this not a burden on the taxpayer as we expand what we envision here. And, one of the important area, and probably the most obvious, is to reduce the prison population. And that's not something that happens in a vacuum amongst the people here or the people at George W. Hill. Although we do have a voice in that, in preparing people for life on the outside, we can help. But it does require the cooperation of the other criminal justice stakeholders to identify people who are better off rehabilitating themselves somewhere besides George W. Hill. And that's no discredit to what we're doing there, but there are folks who don't belong there, who need to be treated with, the best that's available in terms of mental health or drug addiction treatment. That's really hard to do in the context of incarceration. And, people who perhaps are there because they just couldn't post bail. They're not really serving any danger to society, but for the fact that they're a little poorer than the other person who was. To me, that's not really a good criteria for incarcerating. So, I think we have work to do with regard to these other stakeholders, but that is an area as we drive this population down to those who truly do need to be there. We're going to create space in that budget without creating a burden on the taxpayer to lean more in and keep this, flywheel turning in a positive direction that we want. So I'll stop at that, but we will have some more comments when we get to our discussion of the visit. Anything else for the warden?
I'd like to take the opportunity to amend the agenda. Instead of the Deputy Warden's report, we will have Program Administrator and Reentry Administrator Kelly Shaw provide a presentation for the board this evening. And I'd like to invite my Supervisor of the Month up to the podium.
Congratulations.
Thank you.
Well deserved.
Warden Williams. Good evening, members of the board and the public. Thank you for the opportunity to share November and current program updates. The GED program continues to achieve, and for the third time, 6 or more GEDs were earned for the month. Academic instructors have supported incarcerated persons with earning an astounding 45 GEDs for the year, and we still have 1 month to go. And as Warden Williams shared earlier in her presentation, 42 of these GEDs were earned with the assistance of one academic instructor. 21 incarcerated persons earned a Flagger training certificate. The Flagger certificate is accepted by PennDOT and enhances the application process for a public roadway position in Pennsylvania. Volunteer organization thresholds, a 7-week decision-making course, concluded service for the year with 5 program completions. Thresholds will continue service in the new year. 93 incarcerated persons participated in religious services during the month of November. To expand religious and spiritual service availability, volunteers were welcomed back to the facility on Sunday, December 11th. We plan to gradually increase evening volunteerism. Substance use programs Prep 1 and Prep 2 provided therapeutic services for 137 participants, which included 54 new enrollments. Drug and alcohol liaisons released 95 incarcerated persons to inpatient treatment facilities. On Friday, December 2nd, 9 participants completed the first cohort First Step program. The First Step program is funded through the Pathway Home Grant. The vocational program is designed to provide workforce development services pre- and post-release. Cohort 1 services were extended through the end of the year to provide additional support for participants. First Step program participants were provided the opportunity to connect with Neighbor to Neighbor. Neighbor to Neighbor charity organization runs a holiday toy drive. With the assistance of Public Defender Gabrielle Maggio, participants' families were added to Santa's gift list. The next cohort of the First Step program will begin in the new year. The Gold Ring Reentry Initiative program, referred to as GRI, officially kicked off Friday, December 2nd. The program is court stipulated, and currently 3 incarcerated persons are receiving reentry services on a weekly basis. University of Pennsylvania Master of Social Work interns continue with sessions 3 months post-release. Lastly, Thursday, December 1st, we introduced meditation to our juvenile population. The weekly meditation session's goal is to greater the ability of self-calm, heightened self-awareness, improved impulse control, and greater social awareness. Stacy Mandel has generously volunteered to work with our youth. Ms. Mandel is a certified trauma competent professional and certified professional mindfulness teacher. The sessions have been well received, and we are motivated to expand the program. Thank you for your time. May I answer any questions?
I just had a question about the program, the GRI, the Gold Ring Reentry. What is the court stipulated program? Do you know offhand what the criteria is for individuals?
I know as a pilot, they're starting with individuals who are released to Philadelphia. Currently, this program is running in the Philadelphia prison systems, so that's what they wanted to start with, and then hopefully the goal next year is to expand it to Delaware residents who are released in Delaware County. You're welcome.
Any other board member questions? All right.
Thank you.
All right, I think we are at the point for our second round of public comment. So if there are any members of the public who would like to address the board, please do so now. You have 3 minutes, and please give your name and address, as always, in the beginning of your remarks. Please. Yep.
Hi, my name is Augusta DiRosato. My address is 914, is this live? Do I have to give my address?
I'm sorry?
Do I have to give my address, or can I keep that private?
You're really supposed to, unless there's a very specific reason that you can't.
Okay, it's 914 Church Street, Apartment D in Marcus Hook, Pennsylvania, 19061. I was recently released from George W. Hill, November 22nd, and I just have a concern about the medical staff there. I have a repaired Achilles tendon. I had surgery in 2013. At home, I have medicines that were not available at George W. Hill. For 2.5 months, I put in WellPath forms, complained to the nurses who came on our unit to give us medication. And they did nothing until the day before I had court. They gave me an ACE bandage. Because that went ignored for so long, I developed a sort of blister on my ankle. When I got home and started wearing my normal shoes and stuff, it popped. And I had an orthopedic appointment yesterday. They said if the hole, it popped and it hasn't closed for 3 weeks. They said if it doesn't close in another 2 weeks, I'm going to need surgery again on my ankle to remove the stitch they put in and I guess replace it. Right now it is leaking tissue. I thought it was pus, but the doctor told me there was actually scar tissue leaking out of the back of my ankle. This is not the fault of the warden or the correctional officers, but it is the fault of medical because they did not see me when I asked them to. And there are other women in there going through the same thing. I also want to talk about mental health. I feel like the mental health services at George W. Hill could be a lot better. There are therapists and I guess the people under them, I forget what they're called, the interns or whatever, come in and they talk to us on the block. So we do get therapy. We do see Dina, the psychologist, for medication and follow-ups and all that. But I do feel like that the mental health services at George W. Hill could be a lot better, especially for people who cannot post bail or people who don't have bail at all, which is what happens to some people. All the rehabs that George W. Hill is connected to, I feel like they could connect to a lot more mental health, inpatient mental health, other than Norristown Hospital, because Norristown Hospital is for incompetent people. And I have mental health issues. I did not want to go to Norristown after the stories I heard, but I was also not, I guess, deemed unfit enough to go to Norristown Hospital. So while they wanted to get me an outpatient, my public defenders wanted to get me a bed in an inpatient inpatient mental health facility, they couldn't do that because I was deemed unfit for Norristown. And there's a lot of other hospitals like Mercy, Fitzgerald and all that, and yeah.
Thank you, ma'am. I
Thank
appreciate
you.
your coming in and your willingness to address the board. I will say, this isn't any way to dismiss your concerns, because I think my point is we are aware that there is more that needs to be done, particularly around medical and mental health, and that's frankly a county-wide issue of a scarcity of mental health treatment availability. But I appreciate your letting us know about your experience.
Well, I appreciate you listening. That's why I just wanted to come in, and I'm not really speaking just for myself. I'm speaking for the women who are in there right now who do need help, and they reach out to medical and they reach out to mental health, and they don't hear back when they should.
Yep.
Thank you.
And what was your name again?
Augusta Rosato.
So Augusta, I just wanted to thank you for coming out tonight. That takes courage to come to an open board meeting and share your experience. And that's where advocacy comes from, so to come out here and let us know. And that's one of the reasons that this Jail Oversight Board was created. One of the reasons why we have this Jail Oversight Board meeting open to the public at this time for individuals to come out and share that. But oftentimes, people can complain or different things, but to actually show up and do that takes a lot of courage. And I want to thank you for that.
Oh, well, thank you. I appreciate that. I appreciate you listening. Thank you.
Any other public comments for today? All right, hearing none, we'll go to board member comments. Mr. Lazarus?
Thank you, Mr. Chair. Chair Madden brought to my attention that our 3 community member appointees to the Oversight Board are at the end of their initial term. So I do want to make the board aware that I've reached out to Ms. Love, Mr. Corson, Mr. King to gauge their interest in taking on another hitch on the Jail Oversight Board. The reason for doing that, in addition to their diverse expertise and experiences, is that we're still in the stage where stability matters, and I think that they have earned the opportunity to see the transition through to its completion to where we are at a steady state as well. The County Administrative Code states that the Executive Director appoints with confirmation of council, so it's my intent to bring those recommendations back to council once I receive confirmation of their interest.
Thank you, Director Lazarus. Any other board member comments? And I will say I do intend to discuss our visit from last week and invite those who joined to add their comments. But anything else aside from that from the board? All right. So as has been mentioned a couple times throughout the meeting, this past Thursday, it was Thursday, right? It was Thursday. Members of the Jail Oversight Board had an unannounced visit to the jail, and there have been previous sort of ad hoc unannounced visits by board members, but we felt it was important to add more structure to that. There is a per sort of the creation of the Jail Oversight Board, this is to happen twice a year. And going forward, we're going to have, like I said, more structure around that. And I think it was important for all of us that it not just be a list to check things off of, but rather that members of the board had the opportunity to, in addition to really visiting every area, and we visited in teams, we visited intake, we visited the medication-assisted treatment housing wing, we visited juvenile, the female housing, training, medical, the kitchen, the general population, the restricted housing unit, and certainly reviewed kind of the policies, documents, logs that were kept there. And also really had the opportunity to have one-on-one conversations that each of the Jail Oversight Board members who were there were able to with inmates as well as staff members without administration being within earshot. We will be posting the report on the website for the public to view, but I did want to give a bit of a sort of high-level takeaway from our visit. And I'll say a few things, and then I'd open it to other members of the Jail Oversight Board who were there to add their comments. And I think some of these are consistent with what we said earlier. The overall takeaways are that, there are still challenges. I don't think anyone on this board had any expectation that in the span of 8 months that this would be a mission accomplished. And frankly, it will never be. We should never be satisfied with where we are. We should be continuing to improve the jail for both those who work there and those who reside there. But we have really made tremendous strides, and I think that was abundantly clear in our conversations that there is a shifting of culture, and you have people who will struggle with that, who will resist change and don't perhaps like the degree of oversight that we expect at every level of the institution. But you could really hear through many conversations a buy-in of the vision that is coming from top down, from the warden down through the deputies and so on. But I think we do have higher expectations, and like I said, there will be resistance to that. Challenges, as has been mentioned a few times, the infrastructure is badly in need of investment that has been starved over the past 20 years. We are playing catch up. There's $30 million in the capital plan for this coming year and the year that follows. That's a significant investment, and it dwarfs what has been invested at George W. Hill since, frankly, the time it was built in 1998. So, you heard, and our observations were areas that were in need of better maintenance and repair. We talked about the kitchen, the fact that the kitchen needs to be completely overhauled. And I think, staffing, we talked about earlier, mandated overtime just provides a burden on staff that I think contributes to the challenges around retention. And this is really a sort of a chicken and the egg, but as we fully staff, I think what came through in the conversations that we had was, you will improve morale. And again, there's that sort of positive reinforcement of less burden on staff. And so that all really comes from fully staffing the facility. And also in-service training. What we heard was that while the training to begin your time through the academy had improved significantly from the time under GEO, there's still more to be done there. But certainly after people complete their training and they go into working, there needs to be more in-service that is continuing. That was paused during COVID. And it hasn't really come back to the degree it should by any stretch because of both that as well as the staffing shortages. I think it's hard to really sometimes justify bringing someone off of their post for training when you're short-staffed, but we need to be adding that back in order to really ensure that training doesn't get lost as folks get, as they finish their training, they go into work. Another positive we heard was the contraband, the fact that in conversations with inmates, we heard that it's present, but there's been a marked decrease from what it used to be. And again, we're not going to be satisfied with that until there is no contraband. But it seems to be moving in the right direction is the impression that we got. The change in mail to digital has had a real impact. The new body scanners that were recently approved should have a significant impact. It would put us from a laggard to a leader in body scanning technology, both for the safety of staff and for inmates. And also the impact that it has on folks who are dealing with addiction. If they have continuous access to the drugs that they're trying to get off of, it really undermines their efforts. So we really have to continue to make the improvements that we've seen thus far on contraband. I will just touch on this because I was in a part of the MAT housing unit. It sounded like the conversations that were had with inmates there were promising. Medical, as was mentioned by the member of the public who spoke earlier, medical understaffing, delays in treatment, that is an ongoing concern that has to be addressed with our partners at WellPath. And what that also impacts in terms of intake delays, that people are in intake longer than they should, and therefore there's overcrowding. But again, overall, there is much work to be done, but we see some significant changes from where it was 9 months ago. With that, I will turn it over to those who participated and see if there's anything else they'd like to add to that.
Thank you, Chairman Madden. In going in there, I completely agree with you with the atmosphere with the team, and I want to thank the warden and her team for giving us full-on access. That was the thing about the opportunity to go there. I mean, we had the opportunity to go from cell to cell to cell, from block to block, and really talk to residents in George W. Hill privately. And one of the things I was most impressed with was there wasn't some underlining common theme or grievance, across the board that was a pattern. A lot of individuals, they are in prison, but services were satisfactory, safety was satisfactory. There wasn't things like I'm not getting rec time or I'm not getting this service and things that we had heard from in years past. And I was definitely impressed with any barriers that we identified, the warden having a plan and a solution of what they are working on to overcome them. That it wasn't like, oh, we just discovered something. We know there's a barrier there, and we have some solutions that we're currently working on to overcome that. One common theme is, as Councilman Madden, touched on, was, the staffing situation when it comes to WellPath. And sympathy in the fact that right now I know that is something that's common across the board, but I also do know that they are a contracted provider that we, contracted with to provide these services because we knew the barriers there would be to do the medical fully, on our own. So I really like to see in 2023, really working with their management team on how they are going to address this, because just, stating, short staff and industry norms and things, I just don't think, I think that runs out of steam at some point, and it's how we, just as the warden has come up with solutions of how things are going to be addressed, how they are going to address that. And I think that is a goal I know for me on this JOB as we transition into 2023, because they're very important. We're talking about the intake process, but also talking about mental health and substance use and their partners. So, we're working with them, but, what solutions can we come up with together? So I really like to see, their participation in that. But overall, it was a very educational inspection. And that was, was not a tour, it was an inspection. And we had an opportunity to do that. And it was nice to see the progress that's being made, and looking forward, to continue to, have that ability. So, overall, it was a very good experience for myself and my team.
Mr. Lazarus.
Thank you, Mr. Chair. I want to start by thanking both Mr. Resnick and Mr. Corson for letting me tag along with them. My previous visits to Hill have always been about what does the warden, what does the team need? And they've been very focused on moving those support along. So this is the first time I really had a chance to go off the beaten path a little bit, talk to the correctional officers unsupervised and unchaperoned, as well as some of the incarcerated persons. Mr. Madden talked about that the facility is, from a custodial standpoint, is well kept, but there are maintenance issues that we need to address. That ties into the capital improvements that also need to be done. I do agree with the statements too that we need to do better in terms of both providing access to mental health services and substance addiction treatment. There are many people down at Hill who shouldn't be there. Some of that is due to extended pretrial confinement, and in talking to both the DA and public defender, we need to do better in terms of case management and keeping track from a no wrong door perspective of people who come into our care. That will help us bring down the population when we do that, and provide an improvement in the level of care that we provide people who are incarcerated. In talking to the staff, there is a change in culture. It's hard, it'll take some time, but you do see that people are learning that strength comes from kindness and compassion and not through harsh treatment. And I think that change will continue. I mentioned early on at the first shift change to the staff that from my military experience, you never forget your drill sergeant, you never forget your first squad leader, the people who hold you to task with a kind hand. And with the COs, I think they're getting the appreciation that their interactions with the incarcerated population are life-changing. And I think among all the things we saw, that change in culture, albeit slow and maybe grinding at times, is one of the things that is most impressive.
Thank you, Director Lazarus. I don't know if anyone on Zoom had anything that they wanted to add.
Yes, I did.
Go ahead, Mr. King.
Yes, I would first like to say that it was a pleasure doing that inspection, and I really have recognized a lot of the changes that has happened in the last 3 years. I must say I was impressed, but I gotta say honestly, we have a long way to go, no question about it. I don't want this meeting to be like, everything was a home run and everything was so perfect and we're all moving in the right direction, and we don't have an opportunity to always be honest with our county, for sure. It was clean in there, no question about it. It was strange to hear that everyone said that everything was okay. Now, just from my experience of being in a place like that, I must say that I know there's a two-story to everything, right? And I never thought I'd say something like this, but I have to say it, that even the people that work there I'm just as concerned for them as the residents that live there. And I say that, like I said years ago, that, I believe that the residents and the employees have to have some kind of, camaraderie, right? In order to operate such a place or institution in the situation that they are in. Like I said, I spoke to a lot of people. I was kind of still next to my tour person. I wanted to have more of a personal conversation with residents and with people that work there. I didn't have it the way I wanted to, but I know maybe in the future that could change. I think from my tour, I think that loved ones of the people that are there should have a better opportunity of communicating about their loved ones. And I think the people that work there who are maybe underneath the tutelage of sergeants and lieutenants and all those kind of things get an opportunity to express themselves more of some of the concerns that they may have, so we can make that place an even better place. And I wanted to propose something from that tour, what I got. I wanted to know if we can possibly try to find a way to get a better communication line for the public, for their loved ones, and for the people that work there who have concerns and might be scared to say some things, right? How do we create some kind of hotline or number where they can be unanimous so we can get that information that's going to help the jail to be better so we can move forward. And this is nothing to put a black eye on our report, because when we keep it honest and we keep it authentic, we get a great opportunity to see the issues so we can be better in the future. That's what I was put on this board for, as one of the board members. So I must say the visit was very interesting, and it was very promising of the direction that we're going. So I have to give kudos to the staff. If Kelly Shaw is still there, I like to give her kudos, because every time I call there and get in touch with Kelly Shaw, she actually looks into every situation I ask about. So thank you so much. And so I'm going to always bring the highs and the lows so we can be honest with ourselves when it comes to doing such a difficult job for our community. But for all in all, that visit was very educational for me from the perspective of where I'm at. And I got to say, my bias is not in the way. For me to say something about the employees and the residents there, it's a big growth moment for me. So thank you.
All right. Any other comments from board members? Hearing none. Warden, I don't know if there's anything before we adjourn that, in response to anything you heard. You're welcome to. Any last thoughts?
I really appreciate everybody's comments, and I think that it's important. Transparency has been one of the key tenets of County Council. It was one of their values. It's also one of the values of George W. Hill as well. And I think offering a balanced perspective, and Mr. Raheem King does that too. Not to say that everybody else doesn't, but highlighting some of the opportunities with some actual action items, I think is a really positive step too. And being able to have the capacity to discuss that in an open forum is definitely something that is probably a progressive change for this county. So we haven't gotten everything right yet. I think that's an important takeaway, but there is a lot of progress and things to be proud of. And I look forward to continued conversations with this board, the support and the leadership and the direction and guidance, as well as everybody on my team. I could not do it without them. So that's my only response at this time.
Thank you, Warden. And just one last comment I wanted to make, and I failed to earlier. When we talk about sort of transparency and also community involvement, I want to thank our partners, the PA Prison Society. I would certainly welcome, if they're watching or in any way, in addition to the report, if they would like to come to a meeting and address what they saw, I think we would all welcome their input in terms of what they've seen last year versus this year. And same to the Coalition for Prison Reform. I really appreciate all the work that they've done throughout the last several years, and welcome again. They're being a partner in this sort of, oversight of this prison, both in this formal way as well as our informal partners on the outside. So unless there's anything else from the board, I would entertain a motion to adjourn.
I'll make that motion.
Second.
All in favor?
Aye.
Aye. Any opposed?
Aye.
We are adjourned. Thank you all.